Hello, class. Welcome to Flourish Nursing Academy. We'll be discussing the Circle of Willis. The Circle of Willis is a circulatory anastomosis that supplies blood to the brain and surrounding structures. It is named after Thomas Willis, 1621–1675, an English physician. The brain receives its arterial supply from this cerebral arterial circle of Willis. It is also called Willis circle, loop of Willis, cerebral arterial circle, and Willis polygon. Anatomical position. It is located at the base of the brain around the optic chiasma and hypothalamus. Formation of the circle of Willis. The aorta gives off the following branches. Right subclavian artery, which in turn gives the right common carotid and right vertebral arteries. The left subclavian artery, which gives the left vertebral artery. Two systems are participating in the formation of the circle of Willis. 1. Vertebral system. 2. Carotid system. Vertebral system. The left and right vertebral arteries arise from the subclavian arteries and form the basilar artery. The basilar artery gives the following branches. 1. Posterior cerebral artery. It supplies oxygenated blood to the posterior aspect of the brain, that is, the occipital lobe. 2. Superior cerebral artery. It supplies the superior half of the cerebellum and parts of the midbrain. It is not a part of the circle of Willis. Carotid system. The internal carotid artery mainly supplies the anterior aspect of the brain, which is why it is also known as the anterior system. 1. Anterior cerebral artery. The anterior cerebral artery forms the anterolateral portion of the circle of Willis. The anterior cerebral artery supplies a part of the frontal lobe, specifically its medial surface and the upper border. It also supplies the front 4/5 of the corpus callosum. 2. Middle cerebral artery. It does not contribute to the circle. It also gives off the posterior communicating artery, which connects the internal carotid artery to the posterior circulation via the posterior cerebral artery. The left and right anterior cerebral arteries are connected by the anterior communicating artery. Clinical aspects. 1. Stroke. It is the interruption of blood flow in the brain. It is of two types. Ischemic stroke. It is dangerous because the presence of plaque in the internal carotid artery can lead to the formation of thrombus, emboli, which travels to the circle of Willis and can obstruct blood flow, causing an ischemic stroke. Hemorrhagic stroke. It can occur because of an aneurysm that grows and ruptures at a certain point, which can cause an aneurysm that is mostly formed at the division points of arteries, as division points are considered as weak spots in the circulation. Subclavian steal syndrome. In subclavian steal syndrome, blood is stolen from the vertebral artery to preserve blood flow to the upper limb. Subclavian steal syndrome results from a proximal stenosis or narrowing of the subclavian artery, an artery supplied by the aorta, which is also the same blood vessel that eventually feeds the circle of Willis via the vertebral artery. The symptoms include presyncope, sensation that one is about to faint; syncope, fainting; blood pressure; differential between the arms; severe memory problems, etc. As we move forward, research into cerebral circulatory systems, such as the circle of Willis, continues to advance. Innovations in neuroscience and vascular surgery are paving the way for more effective treatments and earlier interventions. experts are delving into how specific genetic markers and lifestyle factors influence the development and prevention of conditions affecting the circle of Willis. It's fascinating how such a small network of arteries can have such a huge impact on our health. I agree. I'm really interested in how this knowledge could lead to new treatment options. Remember, knowledge of the circle of Willis isn't just for passing exams. It's a foundation for understanding brain health and treatment strategies.